So if you have any concerns about that, or if you'd like not to be recorded, you can drop off the line now, and a video link will be provided at the end of this call. I'm going to go ahead and mute everyone's line just so we can eliminate the background noise. But through the GoToMeeting panel on your screen, you have an ability to send messages. So you can enter in a chat request through the GoToMeeting panel. And if you have any questions, or if you'd like me to cover a different topic, please feel free to submit a chat request on the right-hand side. Or if you have any trouble hearing me or seeing the screen, go ahead and use your chat feature on the right-hand side of your screen. This session, runs for 45 minutes. If you have, and we'll provide some time at the end for questions and answers. So if you have any questions during the demo, you can submit them, and I will try my best to answer them either at that time or at the end during the question and answer period. So if we're all set and if we're all ready, we'll go ahead and get started. And as I mentioned, this is a brief overview of the MTBC EMR as it stands today. And we have a number of features that we're going to highlight today, including our integration with billing, clinical components, our electronic prescribing components, our lab connectivity, and so on. And of course, if you have any questions or things that you would like us to touch on during this brief time, submit a question or a chat request through the GoToMeeting panel, and I'll try my best to answer it. So let's go ahead and get started, and we'll take it from there. This is the home screen of the MTBC EMR. This is kind of the starting place for most of our users when they log in. And as any EMR software should, it provides a lot of great usable information to our users. At the top of the home screen, we have a list of the patients who are scheduled for today. At the bottom left, we have unread messages that have been sent to the specific user who's logged in, and incomplete tasks or unopened tasks that have yet to be started. So the messages and the tasks would include such things as lab orders or e-prescribing, depending on how the practice has configured their setup. A lot of the work inside the EMR is launched from the scheduler, and the scheduler is what populates the information on this home screen for today's appointments. And as always, we're able to choose which provider and location that we would like to review just by clicking on this button here to choose which providers and locations. And we can see today these are the appointments for Dr. Demo. Let's go ahead and go to the scheduler for today and take a look at the information that's visible to us here. Now, you'll notice there are a number of appointments scheduled for today with different patients, and these appointments are highlighted in a variety of colors. If we look at the appointments that are in green, what this is telling us is that the patients whose names are in green, that their insurance for today is eligible. And eligible insurance means that we have checked the patient's insurance and we can confirm that they are eligible for today's visit. This is an automated eligibility check that's performed by our systems on or before the day of the appointment. So usually within 24 hours of the appointment, the eligibility will be checked. Our clients also have the ability to check real-time insurance eligibility for walk-in patients or for patients who have just been recently added to the schedule within the 24-hour window. So before or during the same business day, they can always check eligibility. We're also highlighting which patients are ineligible, and these are patients whose names appear in red. The ineligible patients mean that we have checked the eligibility and we can confirm that this patient is not eligible for today's visit. Usually in this situation, the office staff can notify the patient that today's visit will be a self-pay visit, or they can collect updated insurance information, enter it into our system, and confirm the new eligibility details. On the scheduler, we're also highlighting outstanding balances. Since we provide an integrated solution for medical billing and EMR functionality, our clients are also prompted with the outstanding patient balance. One thing that is unique about MTBC is that we provide a complete practice management system, from electronic medical records, as we're demonstrating today, medical billing services, appointment reminder calls, insurance eligibility verification, and many other features. So all of those are integrated and delivered through the EMR. And in fact, many of them are launched through the scheduler. So for example, any patient who's on the schedule for today will automatically receive an appointment reminder call 2 days or 1 day before their visit, depending on how the practice chooses to set up their system. Also, the clinical tools are incorporated and begin or are launched through the scheduler as well. So when we mark a patient as arrived, and that can be done in a number of ways, whether they've checked in through our integrated patient kiosk. We have an integrated kiosk system that our practices can set up at their front desk. So when patients check in through the kiosk, it'll automatically begin the counter when it marks the patient as arrived to show what time the patient has arrived. It'll highlight that entire row in red to notify the staff that the patient has arrived. And if a payment has been made on the patient's account through the kiosk or even through the EMR, the office staff has the ability to open the patient's cash register for that day and review any payments that the patient has made through the kiosk, which of course allows for credit card processing. If a practice wants to just check in a patient naturally or through the normal process, they can just double-click on the patient's account, go ahead and open up the appointment window. And here, one of the things that we provide our clients is the ability to see what information is missing from the patient's record. So here I can see that there is no insurance information on this patient's account. And I can collect that insurance information and also update the system, check the eligibility, and so on if I need to. But this section here, where we highlight missing information, would also tell us if we're missing a date of birth, or an address, or an email, or how many times the patient has been a no-show to our office in the past. But let's say I'm just going to go ahead and check in the patient. I can mark their appointment as completed. I can process their payment through this cash register. So let's say they have a $20 balance and a $9 copay. Well, they owe us $29 today. I can go ahead and enter that payment and print and provide that patient with a receipt of their balance or of their payment. Once we've marked the appointment as completed, we can begin our clinical tracking or our clinical entry for the specific patient. One of the things that a practice will normally do upon completing an appointment is go directly into the chart for that day and begin documenting. They may put the patient in a specific room, which can be done from the same exact screen that we were just on. So in the same appointment edit screen, we can choose which room that this patient will go to, and then the clinical staff can have a tracking of that patient through the office to determine what room the patient will be in, how long they're going to be in that room, and so on. But for now, if we're just going to jump into this appointment, we can go ahead and retrieve this patient's account. And when we talk about retrieving the account, we mean opening up the entire record for this patient. So when I go ahead and click on Retrieve Patient, it's going to open for me all of the information that we have available in the system for this specific patient. And here we can see last name and first name and demographic information. If there was insurance information for this patient, it would be in this section down in the bottom. We can also enter here the specific provider of our practice, who is the provider of record for this patient, what pharmacy this patient visits regularly, and also any alerts that we'd like to enter for this patient, which would be pop-ups or reminders for the staff. At the top of the EMR, we have a series of buttons that are relevant for this specific patient, where we can go and see past and future appointments. We can see a health summary. We can see their past claim summary or the payments that have come in for this patient, scanned documents. We have a section for communication with the patient where the office staff can document phone calls and track the progress on those phone calls, and we have a patient education section. And I'll try my best to cover each of these as we go through this demonstration. At the top portion of the EMR, we have a series of tools that follow the user regardless of where they are in the EMR. If I want to open up the patient search so that I can find other patients, I have my patient search option, my messages, my patient documents, which would include scanned documents in the record, tasks that are assigned to me as the user that's logged in, my prescription manager or my RX manager so that I can track medications that have been submitted, refill requests that have come in, and also the ability to switch user quickly. If I'm working with another provider or with a nurse, we have the ability in the EMR to switch user quickly so that we don't have to log in with our username and password. We can just put in our password and quickly switch user in and out of exam rooms. So while we're on the record for this patient, there are a lot of things that we can do. So if we need to update any demographics, obviously this would be the screen to do so. If we want to see past and future appointments, we can go to the Appointments tab where we can see a list of all of the previous times that this patient has been in the office. If we want to see a health summary, we can click on the Health Summary tab to see the vital signs, the medicines, the assessments, and so on. If we want to see the electronic encounters for this patient or the documented visits, we can click on the Charts tab to see the dates that this patient was last in the office, along with the reasons for visit for each of those dates. So if we want to go ahead and begin our electronic documentation for this patient, I'll just click on the New button below, and I'll go ahead and begin documenting a new visit for this patient. Now here, as soon as we log into this patient's account, there are a few things that come up right away. We have an Alerts button on the left-hand side of the screen that will prompt us for any reminders for the specific patient. Okay, and I'm seeing a message here on the chat that we have lost the audio. Can anyone confirm whether the audio has been lost? Can everyone hear me?
I can hear you.
I can hear you on the phone. Hello?
Okay, let me try. Hello?
Yeah, I hear you. So they
Okay,
may
we'll
be
try
on
this one more time. Hold 1 second.
I can hear you, except I only hear bells now.
Hello, this is Mohammed. Can you hear me now?
Yes, Mohammed, we can hear you now.
Okay, you hear me. Very good then. I'll go ahead and continue. And please, if you have any problems, just please do notify me again. I think that chat function worked pretty well, so I apologize about that. I am calling from a phone here, so it's not. I'm not using the GoToMeeting voice over IP, so I apologize about that. We'll continue then.
Sure. Thank you, Mohammed.
Okay, and yeah, so I've opened up the record for this patient, and I've begun the electronic encounter for this patient. And when I first open it up, I'm taken to this screen where I can see my reason for visit, vital signs, and allergies. And this is where I can either use a template. We have templated notes from here, or some providers will dictate. Other providers will use the keyboard, or even copy notes over from a previous visit. So there are a lot of different ways to get data into the system, and we'll talk about all of those different ways in a minute here. But first, let's think about some of the other features that are on this page. One of the features is the Alerts button, which is going to be highlighted in red if there are any specific alerts for this patient. So if I go ahead and click on the Alerts button, I can see what alerts are due for this patient. And here I can see that there's a lipid panel that's due for this patient. And it tells me the lipid panel complete cholesterol and triglyceride analysis every 5 years, starting at the age of 20. And I can, from the alerts option, I can go ahead and begin documenting that, or I can mark it as done and say that I want to enter a lipid panel order for this patient. If the alerts button is not read, then there'll be no information necessary for me to review that's in there. So it's one way that we alert our providers. Now, if we had documented a reason for visit on the scheduler, that would carry over here. And under history of presenting illness, this is a place that a lot of our providers will dictate information directly into the system. So whether they use Dragon, if they use Dragon Naturally Speaking, they can go ahead and just dictate the history of presenting illness. So they would say, patient is a 25-year-old male who's here for chest pain and a fever. New paragraph. And using that type of dictation software, they can automatically populate the history of presenting illness. And Dragon is a software that we have a discount with the manufacturer, with the vendor, to provide, very good pricing for our clients. So it's something that a lot of our clients do choose. Otherwise, if they want to enter the history of presenting illness, a lot of our clients will create templates. And these templates can be quickly added to the system using the Save and Retrieve Template feature, where they can go choose the template that they want to enter, and they can click Apply to apply that template to today's record, and they'll automatically receive their specific templated note automatically populated. So it's just another way to add items to the history of presenting illness. You can quickly and easily add templates, and then from that point they can go ahead and use Dragon or their keyboard or other ways to update that information. So once we've added that, we can also go ahead and add allergies if we like. Just by clicking into the allergy section, you can say the patient is allergic to penicillin. The nurse or medical assistant can document the blood pressure readings. BMI is automatically calculated after height and weight entries. And once we're ready to continue on, we can go to the past medical history section, where we can document previous diagnosis codes or immunizations or hospitalizations or surgeries from this screen. The social history and family history will allow the patient or the user, to document whether the patient is a smoker, their current employment status, alcohol use, and family history, so mother, father, and so on. And that can be done very quickly using drop-down menus and quick, mouse selection. With our attempt is to avoid the user from having to use the keyboard where possible. And from this screen, they can just move right on to the review of systems and physical exam, where all of our reviews of systems and physical exams are customizable by provider. So if I want to complete a cardiovascular review of system for this patient, I can mark which items are complaints or denials for a specific patient. And just by marking that specific item, it's automatically going to appear in my final review of systems for this patient, and I can enter additional comments in the comments section. So head and neck, patient denies all headaches, migraines, goiter, and so on. And again, all of these items are customizable by user and by provider. So all of our providers, when we initially get them set up in the system, that we will spend time with them to customize their review of systems, and also by specialty. So we'll provide them a custom review of systems based on their specific specialty, and then from there they can go ahead and customize and add and remove items as they see fit. And they can even do it on the fly while they're in the process of entering a review of system. And the same thing for the physical exam entries. When we go into physical exam, we have a list of all of the major physical exam components, and the user, by just clicking into these items, can receive the medical normals. So just by entering or clicking onto any one of these components, they're going to add that to the specific physical exam entry for that patient. So if I wanted to say that the normal for skin is no lesions, no itching, no moles, no ulcerations, no rash, if I want to say that there is a lesion, I can say, you know, slight on right arm below elbow. And I can just hit OK, and that will go ahead and update my specific entry over here, and so on. So all of my specific entries can be done from here, and even we have providers that using the dictation software can automatically populate their note with specific normals. So for example, I'll try one now, and we'll just go ahead and turn this on. So I'll just click into here wherever I want my mouse, drag in full exam. It'll automatically populate. So this will automatically give me my full, even anything I dictated afterwards, it will automatically give me my full normal physical exam. And this is, again, all customizable by provider, by user, just by clicking into it. And they can add components to it. So if I was to say, drag in normal extremities, new paragraph, drag in normal chest, new paragraph, drag in normal skin, and it'll automatically add all of my components. And as I was saying, we work with our providers to make sure that these are updated and representative of their actual notes, so that when they speak it, they get their specific notes. If we continue on to the next section, this is where we have our office tests and assessments. And what's nice about this section is that we're fully integrated with mid-mark devices within the office. So if any one of our clients has mid-mark EKGs or spirometry or Holter monitors or any one of, I think it's 7 to 10 other hardware components from the company mid-mark, we're fully integrated into those devices, and those can be integrated right into this office test section. So that if I have a Holter monitor in exam room number 2, for example, my Holter monitor will automatically appear in this list. That's this list here. And I can actually launch my Holter monitor from the EMR, and my results automatically will come back into the EMR. So it's just a great tool for our clients who want to integrate those types of devices into their office. We're up and running with that. And we're working right now with a number of other vendors, hardware vendors, to provide a similar type of integration. So with the companies like Welsh Allen and Brudrick for EKG machines, we're working on integrations with them, and they're currently in development. For our clients who are going to be documenting diagnosis and procedure codes, they can click right into this section here and pull up their super bill of most commonly used diagnosis codes. And right from here, based on their specific specialty, they can go and select the diagnosis codes for this specific patient. And these codes here, what's important about it is that we will also use the same codes in another section of the EMR for billing. So when we get to that, we'll talk about how these codes get transferred over to MTBC for billing as well. So I can go ahead and mark these diagnosis codes, or if there's another code that I'd like to search for, which maybe I don't know the code number, it's not on my list as one of my most frequently used codes, I can just begin typing in this section to go do a code lookup. And here we're providing our clients with information about which codes are currently expired. So they can see a code. If it's in red, it means that it's currently expired. The practice can double-click on a code that's in blue to mark that code on their list, and go ahead and click OK. And you can see this will automatically add these codes onto the assessment list for this specific patient. Procedures are done in a similar way. I can mark which procedures are currently on the list for this patient, and I can go ahead and select a new procedure from my procedure list, my most common procedures list, and I can go ahead and select those specific codes. And these codes that are marked from here will also get sent over to us for billing. Now, if we go to the plan of care for this patient, we can go ahead and prescribe medications right from here as well. And by clicking into the medicine window, we can immediately be provided with any medication benefit plan information. So if a patient has a benefit plan from SureScript's RX Hub, it'll automatically notify the user of that benefit plan, and they'll have the ability to choose which benefit plan they'd like to use for that patient, if a patient has multiple plans. If we just say use none, we're automatically going to be taken into the RX pad for this patient, and here we can begin searching for the medicine of our choice. So if I want to put in a medicine for this patient, I can just type it out. I see my medicine name, and I can go ahead and select that medicine. If there are drug-to-drug or drug-to-disease or drug-to-allergy warnings, those will be provided right from here. So for example, I had mentioned earlier that the patient is allergic to penicillin. If I was to prescribe anything that includes penicillin, I would be prompted with an allergy when that's active. So for now, I'll just go ahead and select Lipitor for this patient. So no warnings. It gives me some information about the drugs to food. The pharmacy that's selected here has already been marked on this patient's record, so there's no need for the provider to look it up. But if we needed to change the pharmacy, we can do so from here. SIGs can automatically be populated. The provider's most common SIGs can be populated based on the medicine of their choice. So just a little bit of setup early on, the medication list, the favorite medication list, the favorite quantities for that provider can automatically be selected, automatically will calculate day supply, and so on. So once we've entered this information from here, if the patient has any questions about the medication that we're going to prescribe, we can provide the patient with excellent drug education material. And the drug database that we're using is First Data Bank. So an excellent resource for us and for our clients on medications and warnings and drug allergy and so on. That can all be provided directly to the patient. And of course, if we were to provide drug education material to the patient, it'll be marked in the record that this has been provided to the patient on this specific date and so on. So if we're all ready to prescribe this medication, we have the pharmacy, we have the medication name and so on, we can go ahead and click OK, review our summary of the medications that we're going to prescribe today, press OK again, and it will submit this to the pharmacy in real time and mark it on our record here. And again, for the plan of care, the physician can use either one of their templates or can dictate it or can type it into here. So once we've entered our plan of care notes, our social history, and so on, we can enter any additional information that we like. Maybe we have some checkout notes that we want to give to the front desk staff. We can automatically generate a series of patient letters as well. Like, for example, if at the end of this visit we'd like to generate a referral to the referring physician or a back-to-work letter, we can generate that patient letter from here and automatically send it. We can give notes to to our front desk staff, if we'd like this patient to follow up in a specific amount of time, or referrals to go to specific providers, we can automatically mark that from there. And of course, if we wanted to see our note in its full view, we can always do that from our final note view section. And here, we can also enter documentation right from here. And in fact, that's something that a lot of our providers do. Rather than go through step-by-step through each of the sections, they can use this final note view as the place where they enter information. So if I'm reviewing the family history for this patient, I can also ask about another member of the family and ask about the father, for example, and go in here and select father, say, alive at 85, and update the record that way. So right from the final note view, there's a lot of work that we can do as well to document this. And if at the end of this visit we need to fax or print this or forward it to another provider, or print for the patient a list of the medications that we've discussed today, we can do that right from this final note view. So rather than going through each of the individual sections one by one, we can come directly to this final note view section and begin documenting right from here. And if we're all done for this patient, we can go ahead and close the account. I can choose to sign it or not. For now, I'll just click no. And this record is now updated in my list here. Now, since we had already selected diagnosis and procedure codes for this patient, we can go directly to the claim section. Now, this is the section where we can submit the medical billing to MTBC. We can go directly to the claim section and see the diagnosis and procedure codes that are marked on this record. And we had definitely some demo data here, so we'll go ahead and uncheck a few of these just to keep it clean and easy for us. So we have the diagnosis codes that we had selected. We had our procedure codes. We can update the pointers and modifiers if we need to, and of course the system will prompt the user for a number of things. Number one, whether or not the appropriate modifiers have been added. It can automatically select the pointers for our users, and they'll also give a lot of other information about billing readiness. So if this claim is about to be submitted, it's going to let the provider know, hey, are these procedures that are relevant for a patient of this age or demographic, male, female? Are these procedures that require certain modifiers, or do they need to be submitted with medical documentation and progress notes? So there's a lot of billing information and billing intelligence that has been built into the system to add that type of information or prompt the user to provide that type of information. So if we're all set, we can go ahead and either save this claim to send it directly to MTBC for submission, or we can save it as a draft. Depending on what rights I have as a user, I may not be able to send claims directly to MTBC. I may have to save them as a draft and have them be reviewed by a coder later on. So I'll just go ahead and hit save, and of course it's going to prompt me for insurance. So let me just, rather than enter all the insurance, I can just mark it as a self-pay and hit save. So once that's entered, you'll see it automatically appear also on the claim summary for that patient, the total amount submitted, and any amounts that may have been paid or adjusted for this visit, and that's available from here. Now, if we have, for this specific patient, we do have some documents that have been scanned. We can always review those scanned documents right from this Documents tab. I can see all of the documents that have been scanned for this specific patient. If I need to, I can forward these documents to other users. I can print them. I can fax them right from here. And there's a lot that I can do for these specific scanned documents. Maybe before the patient leaves today, we want to provide them some patient education material, where we can go to our education section right from here and click on New. And this will open up for me the ADAM Patient Education Encyclopedia. It's an illustrated encyclopedia as well, so it has a lot of great reference material for the patient. So if I had documented earlier that this patient has asthma, it's just a very simple one, I can just click on asthma and hit search, and immediately it's going to provide me back a series of articles that are relevant to asthma. So I can just go ahead and click on asthma. And this is material that's written by providers for patients. So this is not the same as, of course, going to Google or other search engines and having the patient do their own searching for their condition. It's written by physicians for patients and has a lot of great reference material. And this is also available through our patient health record. So we have an online patient health record that allows patients to review this information and do their own searches through ADAM directly on our PHR. And that's one of the really exciting components of our service, is that it's fully integrated with our own patient health record system. Patients can go online, register an account on their provider's website, and these are websites that we build and we host for our clients. And through that PHR, they're able to, number one, review the clinical information that's been entered into the system in their record. And this is, of course, information that the provider chooses to share. It's not all of the information that's in the system. It's whatever the provider chooses to share with the patient. So scanned documents or lab results, those are all in the system and available for the patient. Patients can also review their claim information online. They can access this encyclopedia online. They can make payments to their provider online, and a number of other tools that are currently live on the PHR. They can request medication refills as well. All of that.
Mohammed, I'm sorry to interrupt. This is Bala. You have 5 more minutes on the demonstration. Would you like to take any questions from the panelists?
Yeah, absolutely. We can definitely do that. So let me go ahead and make sure everybody is unmuted here.
Okay.
And it looks like we're all live. So anybody has any questions, please just feel free to shout them out.
Thank you.
In the beginning, you talked about going in to confirm insurance. Do you have access to all the insurance companies in New Jersey to confirm?
Yes, absolutely. For our New Jersey clients, we're actually really well ahead of the curve on this with eligibility. Most of our EMR users and our billing clients who are not yet EMR users, they have more than 85% of their patients on their schedules will show some type of eligibility information. So that means if you have 25 patients scheduled for that day, more than 20 of those patients are going to have a positive or negative eligibility response. And in fact, Medicare, what's really exciting about Medicare is this is one instance where Medicare is providing even more information than the competition. Medicare eligibility will tell us in real time what the patient's deductible is without any user interaction. So without any, additional clicking by the office staff, they can see right away what the actual real-time deductible is for that specific patient. And that would be a patient whose name appears in green. They can right-click, go down to eligibility, and they can see the actual real-time deductible from Medicaid.
And do you have this for Medicaid as well?
I'm sorry, I'm hearing a lot of...
Are you tapped into Medicaid?
Medicaid eligibility is done through a batch process. So
What?
with a batch process, we submit eligibility.
I'm not hearing you at all.
I'm sorry, yeah, I can't. Okay, let me try muting the lines. So let me just repeat about the Medicaid process. The Medicaid eligibility is done through a batch process. So unfortunately with Medicaid, we don't have real-time eligibility with Medicaid. It means that if the patient is scheduled on the system, then we'll need at least 24 hours to determine the eligibility. And for Medicaid, mostly, we can see a true or false, an up or down, eligible or ineligible type of response. And in other states, they even provide the insurance. So for example, if a patient used to have Medicaid, but now they're on United health insurance, then the Medicaid system will even tell us that we're no longer the carrier for this patient, but check with United, they may have it. So we're able to check eligibility and determine the next insurance company that's actually the carrier. And as I was saying, for New Jersey, upwards of 85% of the patients will have some eligibility information. And of course, there's a little bit of leeway in that depending on the specific practice and their payer mix. So, but we're very strong in eligibility in New Jersey. And I think if we go ahead and use, if you have questions, maybe enter them onto the chat, and I can respond to them that way. Because when I unmuted all of the microphones, we definitely heard a lot of feedback and echoes on there. So go ahead and submit your questions through the chat feature, and I'll read them aloud and respond to them. Okay, and now Joan has a question. What about screens? And Joan, I've unmuted your line. Maybe you can explain a little bit more about that.
For example, the screens for, let's say, pediatricians under EPSDT. Do you do screens? In other words, age-appropriate screens as part of what should happen?
So I think maybe like recommendations, like for what's appropriate for that patient at that age.
No, for example, you might give an adolescent a PHQ-9, a depression screen, or a modified cage for substance abuse. Do you have any of those screens on your system that could be used?
I don't recall specifically. I would have to ask one of our other specialists, but I can definitely check on that for you. What we do have is like kind of age and tobacco use and gender-specific recommendations that are auto-pushed to the user based on that patient that's open. We can quickly see what are the recommendations that are due for that patient. I'm not sure. I'm not sure about the screens that you're mentioning. But that these recommendations.
Because some systems have the screen already that's connected to the system, and the results of the screen get incorporated into the medical records.
Mm-hmm. And I would have to check on that. I don't know the answer to that question.
Okay, thank you.
Thank you. Dr. Bowden has a question. What if I don't want to use your billing service? That's a really good question. We have many clients who are using our EMR without using our billing service. And Dr. Bowden, your line if you want to jump in and respond.
A lot of doctors already have a billing service, and they won't want to change.
Exactly,
that's the issue.
They don't have to change with our service. We have clients who use our EMR as a standalone billing software. They can do their own billing through our EMR or use a completely different billing company and just use our EMR for its clinical components and its integration with the Kiosk, integration with the patient health record, and so on. We kind of incentivize our billing service because it's at 5% of the collected amount. It's a great value. It's all included. It's one very predictable price. But we don't tie anyone into it. We don't require that they do that. So it's definitely available and open to anyone who would like to use it. Okay. Any other questions can be submitted? Dr. Bowden, I see another question here. The E&M guidelines have current meds in the past history. I only saw new meds in the plan. So in our system, what it will do is differentiate when you go to the print view and when you print out the record. It knows what medications are current and what medications are past for that specific patient. So you would see, and as medicines will term and as they'll finish based on 30 pills for 30 days and so on, it'll automatically transfer that medication over into the past medication. And when you go and print your note for that day, it'll definitely differentiate between new medications, So currently added medications and past medications. It'll tell you very clearly new medicines, new prescriptions added today, and current prescriptions that the patient is on. So it clearly tells you here, and also inside the plan of care, it'll automatically select, it'll automatically move medications into the past medications depending on the information that has been entered previously. And you can, for any medication at any time, you can ask the patient, hey, are you still on the lisinopril? They'll say, no, I'm no longer on that. You can deactivate it. Or right from this screen, if the patient says, you know, I'd like to get a refill on that cream that you gave me, the provider can quickly right-click and renew that medicine and automatically refresh that and resend that to the pharmacy to renew it. So it's very quick and very easy to handle medication. And what's great about our system is that we are certified with SureScripts, of course, but we also have an iPhone application that is certified with SureScripts. So today, any of our providers, you included, can go to the Apple Store, look up MTBC, and see our certified e-prescribing application that synchronizes and syncs with the EMR. So it's a full standalone e-prescribing system, but it's also integrated with the EMR. And we're also certified with SureScripts for our web application. So you can do it from the EMR, you can do it from our website, and you can even do it from an iPhone, and they all work together from the same system. Any other questions? You can submit them through the chat, and I'll try my best to answer them. Okay, and I think we're at the 2:35 mark here.
Yep.
Let me go ahead and unmute everyone.
Mm-hmm.
If there anybody has any questions that they want to shout out, feel free to go ahead and do so.
Mm-hmm. Okay. So if none of the panelists have any more questions, we could join the meeting. Thank you, Mohammed, for the demonstration. Just send me the link for the video that you would have recorded of the demonstration, so that way I could share it with the panelists. Thank you again for the demonstration. Have a nice day.
My pleasure. Thank you all, and I will be emailing the link for the video after this meeting. So thank you for your time. And if you have any questions, definitely feel free to email me. My email address is on the link for this meeting. You can go ahead and submit that question, and we'll try our best to answer it by email. Thank you all for your time, and have a great day.
Thank you.